Welcome to Self-Assessment and Corrective Strategies for Movement. In this course, we are going to cover ways that you can look at your own movement and take steps to improve your movement. You'll be able to identify faulty movement patterns, prioritize the corrections, in other words, know which corrections must be done first, and you'll learn basic self-care methods for improving faulty movement patterns. Keep in mind, this course is not a way for you to diagnose or treat any illness, disease, or injury. You're learning how to do self-care. All athletes and anybody who wants to move should know some forms of self-care. So first of all, we're going to start to talk about what it is that we're looking for in terms of movement patterns and why we're looking for it. Why is this important? This is important, first of all, because exercise is important and movement is important. We know that exercise is a great way to reduce stress and improve your health. Movement in general is the best way to stay healthy. So, what happens when somebody decides they want to start doing an exercise program? They decide they're going to go for a run, they haven't done anything in a long time, or they decide they're going to start going to the gym. At Vital Wellness Center, we often see people in this situation because they're injured or hurt. We want to talk a little bit about why that happens. We can look at movement, exercise, and sport in terms of a pyramid. The base of this pyramid here is your movement, your fundamental movement. We'll put an M there. How good are you at doing hip hinging, squatting, a push-up, reaching overhead? How good is your shoulder mobility, your hip mobility? These are things that go into the base of the movement pyramid, fundamental movement patterns. On top of this pyramid, or on top of this base, you can begin to build what we call the performance level. We measure performance level by endurance, speed, strength, power, agility. These are easily measured and can be compared athlete to athlete, and we often will do this. From here, we can begin to build sport-specific skill. This is how you learn how to hit a baseball, throw a baseball. This is how you go to an overhead snatch. Today we're going to be talking about this level and the importance of this level, the fundamental movement patterns first. The reason why we're going to do that is because many people want to work on performance. They want to get stronger, they want to get faster, and I can understand that. So they try to improve all of those factors. They work out harder, they start to do speed work if they're a runner. So they're increasing the size of this. And many people can do this successfully for a while. The bigger the movement base of this pyramid, the bigger the performance level can get. When the performance level overreaches the movement level, we get a knock or a tip over or an injury. And this is where we end up seeing a patient in the office. The idea is work on this first, fundamental movement patterns, in order to be able to work on the performance level. So let's go over some very, very basic fundamental movement patterns, analyze them, self-assess them, and then learn movement strategies in order to correct them. This is a self-assessment called the active straight leg raise. You're going to lie on your back with your legs straight and your toes pulled up towards your body. You're going to leave your knees straight, and one leg at a time, you're going to bring your leg up as high as you can, keeping your knee and ankle in that same position. Keeping your legs straight, you should be able to bring each leg up to 80 degrees. Foam rolling is a great technique for improving mobility of the hips. We're going to start off by foam rolling at the calf and the hamstring. Supporting your body weight with your hands and your opposite foot, you're going to gently roll your leg over the foam roller. Pay more attention to spots that feel tight or slightly painful. Step over the foam roller and roll onto the hamstring on both sides. Next, move up to the glute and piriformis area by crossing one leg over, supporting your body with the opposite foot and your hands. Next, turn to your side, support your body with the opposite leg and hand, and roll in between the greater trochanter and the pelvic bone. Leg lowering is a strategy to improve hip mobility and maintain core stability. Start by bringing both legs up to a 90-degree position or as high as you're comfortable with. Drop one leg down, touch the foam roller, and come back up to the start position. Do the same thing on the other leg. Half kneeling with core activation is a great way to work on hip mobility, especially the anterior hip or hip flexor area. Start in a half kneeling position with your hip, knee, and ankle at 90 degrees. Gently push down into the floor using a PVC pipe or broomstick or anything you have at home to activate the core. Slowly push forward to bend the knee, hip, and ankle and stretch the anterior or front of the hip on the opposite side. Hold this for 10 seconds, return back to the start position, and switch legs. Repeat the same exercise on the other side, holding for 10 seconds. Half kneeling with rotation. Start in a half kneeling position with your hip, knee, and ankle at 90 degrees. Rotate towards one side, stretching both hips in a rotation position. Come back to the middle and repeat to the other side. Back to the middle. Switch legs and rotate in both directions again. The seated piriformis stretch works on hip rotation mobility. Start in a seated position, cross one leg over the other, keep the hip and leg in a comfortable position, and sit tall. Hold for 25 to 30 seconds and repeat on the other leg. The key to this stretch is sitting tall.